We're in Chelsfield Park Hospital, and today is a day where I'm having the hernia repair operation, and the goal is to use hypnosis as the anaesthetic. I don't want general anaesthetic, which is what I was offered originally, and within my family my father had bad reactions to that drug, to the drugs they used at that time at least, and as I don't need it, I can use hypnosis. I thought, well, this is the best way for me to do it.
Has Mr. Hennigan ever suggested that you may have to consent to having an anaesthetic if the hypnosis wasn't successful?
I don't think he mentioned that, but that would be fine. I wouldn't object.
But obviously that would be with your consent at any time, because you're going to be with it, aren't you?
Oh,
to
yes.
be able to give your consent.
Of course I will, yeah.
Yeah. And your wife will be coming to collect you from hospital later?
That's correct.
Okay. And is she going to be with you for 24 hours afterwards?
Yes.
Yes. I mean, we always have to ask this, but normally it's more for the sedation or the anaesthetics. I'm not sure with the self-hypnosis, because you won't actually have any drugs or any sedation drugs in your body.
Yeah.
Although I would imagine you're still going to go ahead and have painkillers.
I better take them with me, because my wife wouldn't like it if I didn't.
Yeah.
I don't think I need to use them, but I can have them.
I haven't seen it personally. I don't think the other girls have seen this either, so I think it's new for us all. Be interesting.
The procedure of hypnosis involves relaxing the mind and the body and getting into that deeper level of non-conscious awareness, the subconscious level.
The time of the incision was 11:22, and the changes in pulse rate and blood pressure are really quite minimal.
People can learn to do hypnosis surprisingly easy if they let it happen. It's a natural state, like daydreaming, drifting off to sleep.
Taking these off my hairs is more, it feels more odd than...
Yep, I'll do that for you.
It feels like I've just I have nothing done.
Okay. Well, for God's sake, don't fall off the bed on film, alright? Just stay as you are for the moment.
Can you cough, please? Once more.
Looks fine.
There you go.
Oh, well, thank you very much, Tom. That was excellent.
I've arrested recovery then for a bite to eat, and I'll come up and have a...
I'd like to speak to you later.
Yeah, no, I'll come up to the ward. Well, I'm astonished that it's possible to do the operation without any anaesthesia, and I have seen it once before because we did a hernia with Mr. Butler acting as the hypnotist for another patient. When you turn off a general anaesthetic, people have a lot of pain when they wake up. But you've turned off your hypnotic anaesthetic and there's nothing.
I gave a carry-over suggestion that it's going to be okay and numb and while the healing is going on.
So have a bite to eat and then
Oh, that's
Is
great.
there someone giving you a lift home?
My wife is coming to collect me later this evening.
Good. Brilliant.
But I'll enjoy the rest while I'm here.
Yes, exactly. Good. Nice
Great to
to
speak to you again, Tom, and thanks so much.
Good.
It's perfect. There's absolutely no pain. I gave myself suggestions to relax, bypass the critical factor of the mind. Gave suggestions the area is becoming numb and losing sensation, and everything that happens down there is going to be comfortable, and I'll be able to feel things because I may need to be able to move for whatever reason, you know, but I don't want to feel any pain, so that was fine. And it is an odd feeling, things are getting pushed around inside you. But it's odd more than painful.
And what do you feel of the injury there now?
It feels fine. It feels fine. I'm keeping suggestions going on it every so often, just to say to it to continue to relax and heal. It's fine, really.
How much practice do you think it takes to get yourself into such a frame of mind? Is it skills that your students could pick up?
I think it could. I think a lot of people could learn this. I mean, whether they would all want to do this is another matter. And to what extent they learn it and develop it, that's a good question. I mean, but you know, it's possible that anybody could do it. Yeah. We're looking forward to getting on with things. I mean, I could walk out of here right now, but I think it's just wise to let it rest for a little bit. I've also got myself into a relaxed state of mind. I feel like enjoying the rest.